Piles, also known as hemorrhoids, are a common medical condition that affects millions of people worldwide. They are swollen blood vessels located in the rectum or anus and can cause discomfort, pain, and bleeding. In this overview, we will delve into the causes, symptoms, diagnosis, treatment options, and prevention strategies for piles. Causes. Piles can develop for various reasons, and several factors can contribute to their formation. Straining during bowel movements. One of the primary causes of piles is excessive straining during bowel movements. This can occur due to chronic constipation or diarrhea, which puts pressure on the blood vessels in the rectal area. Pregnancy. Pregnant women are more prone to developing piles due to increased pressure on the pelvic blood vessels and hormonal changes that can weaken the veins in the rectal area. Obesity. Being overweight or obese can also increase the risk of developing piles as it places additional pressure on the rectal blood vessels. Aging. The risk of piles tends to increase with age as the tissues supporting the blood vessels in the rectal area weaken over time. Chronic cough or lifting heavy objects. Conditions that lead to chronic coughing or heavy lifting can increase abdominal pressure and contribute to the development of piles. Sitting for prolonged periods. People who sit for long periods, such as office workers, may be at a higher risk of developing piles because sitting can place pressure on the rectal blood vessels. Symptoms. Piles can vary in severity, and not everyone with the condition experiences symptoms. However, common symptoms of piles include rectal bleeding. One of the most common symptoms is the presence of bright red blood on toilet paper or in the toilet bowl after a bowel movement. Pain and discomfort. Piles can cause pain and discomfort, especially during bowel movements or when sitting for extended periods. Itching and irritation. The area around the anus may become itchy and irritated, leading to discomfort. Swelling and lumps. In some cases, piles can lead to the formation of soft lumps or protrusions around the anus. Mucus discharge. Some individuals may notice mucus discharge from the rectum. Diagnosis. Diagnosing piles typically involves a combination of a physical examination and a review of your medical history. The healthcare provider may perform a digital rectal examination to check for the presence of swollen blood vessels. In some cases, further diagnostic tests may be recommended, such as anoscopy. This involves using a small, tubular instrument to examine the inside of the anus and lower rectum. Sigmoidoscopy or colonoscopy. These procedures allow for a more comprehensive examination of the rectum and colon and are usually recommended if there is a suspicion of other gastrointestinal issues. Barium enema. This X-ray procedure involves the use of a contrast medium to visualize the colon and rectum. Treatment options. The treatment of piles depends on their severity and the presence of symptoms. Common treatment options include lifestyle and dietary changes. Managing constipation or diarrhea through a high-fiber diet, adequate hydration, and regular exercise can help alleviate symptoms and prevent the recurrence of piles. Over-the-counter OTC medications. OTC creams, ointments, and suppositories containing ingredients like hydrocortisone can provide relief from itching and discomfort. Prescription medications. If OTC treatments are not effective, your healthcare provider may prescribe stronger medications such as topical steroids or pain relievers. Minimally invasive procedures. For more severe cases, various minimally invasive procedures can be performed to shrink or remove piles. These include rubber band ligation, sclerotherapy, and infrared coagulation. Surgery. In rare cases where other treatments are not effective, surgical removal of piles may be necessary. This is typically reserved for severe or recurrent cases. Prevention. Preventing piles involves adopting a healthy lifestyle and dietary habits. Here are some preventive measures. High-fiber diet. Consuming foods rich in fiber, such as fruits, vegetables, whole grains, and legumes, can prevent constipation and make bowel movements easier. Adequate hydration. Drinking plenty of water helps keep stools soft and reduces the risk of constipation. Regular exercise. Engaging in physical activity on a regular basis promotes healthy digestion and helps maintain a healthy body weight. Avoiding straining. Avoid excessive straining during bowel movements. If you feel the need to strain, it's essential to address the underlying cause, such as constipation. Good toilet habits. Do not delay bowel movements when you feel the urge, and avoid sitting on the toilet for extended periods. Maintain a healthy body weight. If you are overweight, losing excess weight can reduce the pressure on the rectal blood vessels. In conclusion, piles are a common and often manageable medical condition that can cause discomfort and inconvenience. Understanding the causes, symptoms, diagnosis, treatment options, and prevention strategies is essential for individuals dealing with this condition. If you suspect you have piles or experience any related symptoms, it's crucial to consult a healthcare provider for a proper evaluation and guidance on the most suitable treatment plan.